Across the country, provincial governments have been announcing that they'll be working with private clinics to reduce surgical backlogs. What does this mean for patients? Today, we're going to talk with Bacchus Barua. He's the Director of Health Policy Studies at the Fraser Institute. To learn more about this, Bacchus, thanks for taking a few minutes to chat.
Thank you for having this conversation.
So I know you've studied this issue. You've looked into it now for a number of years. So correct me if I'm wrong, but basically, what this means for a patient is if I need my hip done, the government might tell me that instead of going to a government hospital, I might end up at maybe a private clinic. I go in, I get the procedure done, and then I walk out just like I would at the hospital. I'm not presented with a large bill. Is that essentially what's happening here?
Yeah, I mean, that's a good summary. Of course, things will vary depending on different provinces. It's going to vary depending on how governments contract them out. But from what we've seen across the board, it's just going to be a difference of where the care is actually going to be delivered without any difference to the patient whatsoever. Ultimately, there's just a question of governments funding different institutions. Earlier on, it would be, technically hospitals are in Canada are private not-for-profit institutions, but they're essentially public hospitals. And now this is just an increased collaboration with the private sector to deliver on the universal healthcare promise. If anything, I would be willing to bet that there are probably many patients who've already probably received treatments in private hospitals without actually knowing about it, with these new contracts that are coming in where governments are funding these private clinics. So no difference for the patient, just a difference in terms of where the care is being delivered while it's still being funded by government.
And this has been kind of positioned by many people who are, I think, typically opponents. Some people may be looking for clicks on their website, but they kind of refer to it as like a controversial thing. But as you noted, there's already a lot of aspects where this happens. I think about here in Alberta, I have to get my blood tested. I go to a clinic. It might be privately run, but you just don't even think of it. They take your blood, you leave, and as long as they don't rip apart your vein, you're pretty happy with the service, right? Or maybe you get an MRI done at a private facility or an ultrasound or whatever. But it's really following that kind of way of service delivery, isn't it?
Yeah, I don't know why it's controversial, and I think it's quite sad that it's a controversial path forward, because in many ways this is really following the examples that we see in other countries with universal healthcare, where the goal of delivering on universal healthcare is primary, and it's a secondary question of whether that's delivered through a public institution or a private institution. Most other countries, when we look at Germany, Australia, the Netherlands, Switzerland, New Zealand, all of them collaborate with the private sector because they understand that they are a vital tool for delivering on the universal healthcare promise. And in fact, many of these countries go far beyond what we're looking at in Canada, with private insurers for core services, private for-profit hospitals, all within or integrated with the public system. What's happening in Canada, I think, is a very small but an important step forward, which is purely just about contracting existing private medical clinics in order to deliver publicly funded services. I definitely think this is a first step in the right, really understanding the importance of this collaboration. And I do actually hope that in the future we see further collaboration and integration where both the public and the private sector are able to deliver services to the patients, which is ultimately what it's all about.
Now, I kind of think of this as almost being a little bit like you're looking for a car, right? You don't just go to the first dealership and buy it. You typically would shop around. And isn't that kind of what governments are doing here? They put out a tender and they say, okay, we need help reducing our surgical backlog. We need someone who can do, say, knee or hip surgeries. And then people put in bids and governments select one. Is that kind of a fair comparison from where you stand?
It's an interesting way to think about it. I'm not sure how many private providers there are to shop around for and from. Um, the way I think about it is this is really about looking at the ability to dynamically shift the supply of services in accordance with the demand for services. Um, Usually, in the situation that we have right now, when we have a large increase in demand, or if we have the sort of backlogs that we're seeing right now as a result of the postponement of surgeries, it would take a lot of money, a lot of time in order to build hospitals to eventually deliver on the care. And who knows what the consequences are to patients while they're waiting for those hospitals to be built. what's happening here is a way of approaching things much more dynamically, which is saying, okay, when you have a rise in the demand for services, but you're unsure whether it's permanent or it's temporary or it's transitionary, this is a way to bring in existing providers to help provide services to compensate for that demand. And because you aren't investing in that capital, you're saving on those capital costs, and you're also not committing long term into the future into that, because you might end up in a situation where you may no longer need as many services, although that's unlikely given the population growth and change in demographics. But you might also have differences in what kind of services are to be provided. But this is really, us looking around and saying, okay, what tools do we have at our disposal? Like you said, look around at what can deliver services, because what's clear is that there is a demand and there is a need for these services. And we have these suppliers in our system that are outside the purview of the public healthcare system. And this is just a way of saying, hey, come into our delivery system so that we can actually deliver these services to patients. I think it's just a common sense policy going forward, particularly in the situation that we're in right now.
And you had looked into, you meaning the Fraser Institute, wrote a report on the Saskatchewan Surgical Initiative. It's kind of one of the more popular examples when it comes to this type of relationship between the public system and private clinics. And so they had announced this back in, I think it was 2010, that they were going to be moving forward with hiring private clinics to help reduce their surgical backlog. Could you tell us about the sort of the big picture findings that your analysis into their project, how that worked out?
Yeah, we were very fortunate to have Dr. Janice McKinnon author a report for us looking at the Saskatchewan Surgical Initiative. As you know, she's a former MP with the NDP, which was actually not in power, I think, at the time when the SSI was being implemented. So, really interesting confluence of interest over there. But this was a really important initiative for multiple reasons. We'll talk about private clinics, which was one part of it, but there are a number of things that they did. They did look at things in terms of their management. They implemented the lean management system to try and figure out if there were efficiencies within the hospital. They also looked at pooled patient referrals, which is basically, in Canada, we have a system where you have to go to your GP gets your referral to a particular specialist within their network. And they really changed that system to say, okay, well, if anybody needs a referral to a specialist, everybody goes into a central pool, and then you're matched up with the specialist who has the shortest wait time within your area, while retaining the choice to be able to wait longer for a specialist of your physician's choice. Mm-hmm. And then the third thing, which was the most controversial, was the contracting with the private clinics. And this is because at that time, Saskatchewan understood that they needed to expand capacity dramatically because they were in a very, very bad situation. If we look at data from Waiting Your Turn, which was our annual survey, in 2008, so this is about 2 years before the SSI, Saskatchewan actually had the longest wait times in Canada, 28.8 weeks. It was a little bit better by 2010, it was 26 weeks, but that was still the longest wait times outside of Atlantic Canada. What was really interesting is we were actually able to track what happened in Saskatchewan and indeed across the country during the 4-year SSI initiative. And we actually saw that wait times fell from those 26 weeks to 14.2 weeks by the end of the SSI in 2014. And that wait time was the second shortest in the country. Only, I think, Ontario at the time had a shorter wait time. And by 2015, 1 year after the initiative, Saskatchewan actually had the shortest wait times in the country. Now, this is not to say that, a 13 or a 14-week wait is great or is nothing, but it was the shortest in a country where, other provinces were experiencing much longer wait times. What should also be said, however, with the Saskatchewan Surgical Initiative is that it's also important for us to look at what happened after the SSI. And this tells us, this is a little bit of a cautionary tale, not just about, I would say, about private contracts, but really about healthcare reform more generally. Because when we look at the years following the SSI, although they had those low wait times in 2014, 2015, slowly they started to creep up, and Saskatchewan started to struggle with wait times again in the future. And the reason is because there weren't further reforms. There was no more contracting. It was just, a one-step solution. And I urge, individuals to think about the fact that private contracting with clinics is not the last step that will solve healthcare. It is the
Mhm.
first step
Mhm.
in terms of fixing our healthcare system and does need to be followed by reform in the future. But undoubtedly, even though it's still a first step, it's absolutely there in the data and in the evidence that it did contribute to shorter wait times, particularly in Saskatchewan.
Mm. And also there was a cost savings element to this too, wasn't there?
Yeah, this was a really interesting finding. One of the things that Dr. McKinnon's study found is that the private clinics were able to deliver services at a lower cost per procedure. In fact, they were delivering the services at a cost of 26% less than comparable public institutions for the same procedure. Now, again, the caveat over there is that total cost in the system increased, but that's because they were actually performing more
Mhm.
surgeries and delivering more services. So your total costs are going to go up, but in terms of per procedure cost, it was actually lower. And this, ties in a little bit, I think, into the larger discussion that we're having about the importance of setting the rules of the game. So one of the things about the contracts in the SSI was that it was in the contract or the bidding process that the private clinics had to be delivering these services charged to the public system at a comparable or lower cost compared to what public hospitals were delivering it at. And they actually had to do quite a lot of work to try and figure out what public hospitals were delivering it at, because there isn't that much transparency, or there wasn't that much transparency or accounting at that time. But that's really setting the playing field straight to say, okay, we're going to fund these services, but you better be as efficient at least as the public system when you're going to do it. And I think without those sort of caveats, and certainly in the absence of competition, things could certainly go the other way. So very important to set the rules of the game up front. And when you do, I think it can be a very successful step forward in terms of delivering care to patients while keeping your costs more efficient in terms of per procedure costs.
And to ask you the opposite, are you aware of examples of where maybe this has gone wrong?
Yeah, it's entirely possible that that can happen, and this depends on again how the rules of the game is set up and what are the incentive structures. I think if you look at not particularly contracting of private services, but just the ability to get some private treatment in, for example, British Columbia. If you look at the 2000s, there is evidence where the fee that would be paid to a private clinic could be higher than what would be paid to the public clinic. Of course, patients were able to get treatment faster in those private clinics. And there are two things that are important to look at there. One of them is that even if the fee is higher, there were some organizations that were funding this at the time that actually found that even though it was a higher fee, it was saving them in the long run because the societal costs were lower because patients were actually getting treated quicker and could get back to work. And so the higher fee being paid individually to the private clinic was worth the extra cost because it saved them, because it helped the benefit to society and to those individuals to get back to work and be another productive part of society. And then the other is again just about what the rules of the game are. Is this are we talking about treatments where it's a free for all situation where people can go and pay any fee that they want, and that then is determined by the market, or is it a situation where we're saying, okay, this is going to be funded by government, it's going to be funded through taxation, and at the very least, we'd like to have an accounting whereby these clinics are delivering services at the same or lower cost per procedure. Very, very important to set the rules of the game straight. And I think very, very important to have competition as part of all of this. I mean, we don't want to end up in a situation where we're simply substituting public for private, and these contracts are just going out to, to a new monopoly on the private sector.
Mhm.
Ideally, you'd like to have a competitive system where when there are, what we call excess profits being made, competition comes in to fill the vacuum and actually bring those costs back down. So it's all about setting the rules of the game correctly from the beginning and then reviewing them as you go through it.
I really liked your comment there about the cost to society of someone waiting, because there's all kinds of costs that I don't think get examined by governments, right? It's someone who's sitting on the sidelines of life, they can't work anymore, or they're off work for a year because they're waiting to get their hip surgery. Well, they might be dependent on social assistance in the meantime. They're certainly, their income would be down, so they'd be paying less in taxes. There's the impact of their life too, which is hard to quantify, right? When they can't maybe go in the backyard and play football or something with their kids or whatever, right? There's all those costs. So it is interesting when how you once those start to be made part of the same picture. But when I think about this whole topic, when it comes to healthcare services, I think of it from the patient's perspective. And I think the typical patient would be looking at three things when it comes to surgery. One, they want to make sure it's done right. Two, they want to make sure it's done in a timely manner. And three, in especially here in Canada, they want to walk out the door when it's done. They don't want to be presented with a big bill. We've talked about the last two, but the first one, just to clarify, when governments hire a private clinic to do surgeries, they have to meet the same standards as the public system, don't they?
Absolutely. Again, with the caveat of we can't predict what different governments will do in the future, but one of the best examples we have, as you mentioned, is the Saskatchewan Surgical Initiative. And absolutely, it was right there in the contract that the service standards have to be the same, that they have to, in some ways, abide by the Canada Health Act, and that they had to provide it in a cost-efficient manner. And I think this was just a smart part on the government to say, okay, if we're going to be funding you, then we have certain expectations, which is a completely fair thing to do.
Yeah.
And I think is important to encourage it as well.
Yeah, I think that's obviously something that you want to do as a government. You want to make sure that no one is stitching a patient up with Scotch tape when maybe they need to do stitches, which might be a bit more expensive. They have to meet those same service levels, and that's what I've always understood to be the case. I think that's it for my questions. Is there anything important maybe in this topic that I haven't asked you about that you think we should chat about?
No, I think it's been a wonderful discussion, and I do regret that we're having this discussion in 2022 rather than in 2018 or 2019. Our healthcare system's really in trouble right now. As a result of the backlogs that we're having from COVID, and for sure, I think there's a greater understanding and need from Canadians' perspective for this reform. But unfortunately, now we're starting to look at these things from a place of weakness and desperation, whereas we could have been doing these things from a place of strength if we had done this proactively before the pandemic hit. And I think really the lesson for us is that absolutely this is what we should be doing right now, but that's not where we should stop. When things stabilize, we should take that opportunity and say, okay, we're in a good place right now. Let's experiment. Let's learn from these other countries that are doing a better job in normal times. When it comes to universal healthcare, countries like Australia, Germany, Netherlands, Switzerland, Sweden. Let's see what we can import from them and what we can see works in a Canadian context, so that when the next pandemic is around the corner, or when the system's starting to have issues, either because of resource or something else, we're ready. We've done our work in the past, and then we can implement them going forward. We're very lucky that we have the SSI to look back on, and we have some good data to say, okay, here's some good best practices to look at when you're contracting these services. We have some experience actually during COVID as well, where many provinces were contracting services with the private sector to help with that sort of backlog. And I just hope that we take those lessons going forward and really start to, instead of thinking about the preservation of the healthcare system and then expecting patients to adapt to it, we should think about the delivery of care to patients and then adapt the healthcare system to that. It's about just putting patients first, because that's really ultimately what the healthcare system is about.
I agree 100%. I think too often patients aren't placed at the middle of this system. There's all kinds of other competing interests that seem to direct attention away. And I'd also agree with what you said about, it's unfortunate that we're having to deal with this now in the middle of a crisis rather than having a bit of vision, because your organization's been doing lots of great research on healthcare policy for decades now, including, as I mentioned, the research you've done into Saskatchewan's initiative there. I mean, your analysis has been out there for years and years and years. It's too bad that policymakers didn't latch onto it a long time ago, because they could have avoided a lot of the pain and suffering that patients are going through now. But I mentioned that in your other research. How do viewers find it if they'd like to see some more of the work that you've been doing at the Fraser Institute?
Well, thanks so much for the kind words. All of our research is available at fraserinstitute.org, and all of our papers are free for the public to download. And to the extent possible, we actually also try and make sure that we're using public sources for our data and for information, because we do believe in transparency. So I urge anyone to go and look at look at our reports, look at the other reports, get the best data that you can, because I think all of us ultimately do want to find ways to improve the healthcare system. And in that way, we're all really on the same side of this conversation.
I completely agree. Thank you, Bacchus. And viewers, I'd encourage you to give them a follow on Twitter, and follow the Fraser Institute too, and check out their research. Thanks again for your time.
Thanks so much, Colin. A pleasure.